Machine learning is a subset of artificial intelligence. So it's essentially advanced statistics that can find patterns in data that maybe humans are not able to find, or maybe in medicine predict which patients have a higher risk for complications.
This is the Man Up Podcast, a doctor's guide to men's health.
If you've been enjoying listening to our podcast, please hit the subscribe button on YouTube, Spotify, and Apple Podcasts.
My name is Dr. Kevin Chu, and I'm joined as always with my co-host, Dr. Justin Dubin. This week's episode is titled Man and Machine, Exploring AI in Men's Health. This week, we're going to be joined by Dr. Michel Bielecki, who's the CEO of IllumiCell AI, and we're going to have a great conversation on this space, right, Justin?
It's a very exciting space. I've done a review paper on AI and men's health. I think it's one of the best spaces that AI will be very promising in. So let's just start off, Michelle, with an introduction. Tell our listeners about yourself, your background, and we'll take it from there.
Sure. Very happy to be on this podcast. Thanks for having me, guys. Appreciate it. But yeah, my name is Michel. I was born and raised in Switzerland, did my medical training at the University of Zurich. Then I worked initially in infectious diseases and epidemiology, which turned out to be quite serendipitous when it comes to the pandemic. When it broke out, I was doing partly research. On the other hand, working for the Swiss Armed Forces. I took over the nationwide COVID-19 testing and then got deployed in a function of a chief medical officer for the NATO in the Balkans, where I served for a while. During that time, I actually co-founded my first startup with also my current co-founder, Jayla, which came out of her personal need to travel. If you remember back then, you needed COVID tests if you wanted to go anywhere. And most of the COVID tests, you needed to go to a lab, be in a room with infectious people, which was extremely smart, right? Nothing was. And so she was introduced to me via a few friends, and I told her, like, I'm sure somebody's doing this online. Like, just find a service that provides this. Turns out nobody did it. She was a McKinsey consultant, and we're like, hey, you know what? Why don't we build this up, right? I mean, I have the medical expertise. I've been in this space for the last year. I know everything about this, and you have the business acumen, and let's build a startup. So we did that. We had a team of 30 doctors at some point doing essentially remote telemedical diagnostics. We bootstrapped it, scaled it to multiple countries in Europe. It was exciting, operationally very challenging. And then I came to the East Coast, did my master's in public health at Harvard. And then we eventually co-founded the current venture, which is in male fertility. And I'm not really sure how that happened, but yeah, here I am.
Well, that's awesome. That sounds great. We're going to really kind of hear a lot about your company and what you guys are doing. And I'm really excited to kind of discuss some of that and kind of dig into that. But before we start, let's kind of set up a little platform for our listeners. And so one of the terminologies that we hear often is the word machine learning. And then we hear the terminology artificial intelligence. So could you kind of give our listeners an explanation of what they both mean, if there's any differences between them?
Yeah, of course. People use that term interchangeably and also often as a buzzword. But like ultimately, machine learning is a subset of artificial intelligence, right? So it's essentially advanced statistics that can like find patterns in data that maybe humans are not able to find, detect subtle correlations in imaging, for example, or maybe in medicine predict which patients have a higher risk for complications, right? Artificial intelligence is, and that's what many people don't know, but that's a term coined in the 50s. Like, you might know Alan Turing. He's one of the godfathers of AI, essentially, and the mathematical foundations for AI were developed then. So why is it popular now? And it kind of boils down to the computational advancements we've made in the early 2000s. Like, suddenly we had the computational power to execute upon a lot of the models that were developed. And then you had the first kind of AI boom in 2015, 2016, right? Like, that was all over the place. And then every single startup that did a simple logistic regression put AI in their pitch deck because that's what investors wanted to hear, which lasted for, and then, I think people noticed that maybe AI is not as advanced as they thought it would be. And blockchain became very popular. And suddenly everybody was a blockchain and AI startup. That was like, and I think well, not really, but like, I think then in 2023, when OpenAI released their ChatGPT 3 model that was suddenly able to communicate with people, that's when the next AI boom started. And I think when people refer to AI today, they typically refer to large language models. They typically refer to generative AI, which is also technically a subset of AI, right? And then you can go technically a step further, which is what's being discussed very widely in the AI community, which is AGI, which is essentially artificial general intelligence. And that would be what you see in the Terminator movies, like kind of a science fiction version of a self-AI, a self-aware system that can reason flexibly like humans. And well, it is already indistinguishable, I would say. Yeah, so those are the kind of three terms. You have ML, which are the tools within AI. You have AI that can reason, that can talk to you, and then you have the AGI umbrella. Does that make sense?
Oh, absolutely. And so when we're going now, as I was learning before, I do think that there is a huge opportunity in terms of improving many aspects of our health in general, but especially in the men's health space. So you've already said, right? IllumiCell AI really is focusing on male infertility. What inspired you to focus specifically in the male infertility space? Was there some kind of, you know, something that you saw that was lacking, or something that you really thought the AI would be great in the male fertility space?
Sure. And so I'll be candid. I'm not in male infertility because I have a personal crusade around male infertility. To me, it's the bigger picture of digitalization in medicine. I think compared to any other industry, medicine is astonishingly under automated. You have redundant tests, you have redundant workflows, you have a near complete absence of quality control, which would be unthinkable in aviation or finance. Imagine a pilot who goes like, ladies and gentlemen, I'm turning off the autopilot, but don't worry, I've been doing this for 20 years. And we have the tools in medicine to do something about it, but like they're not being used. And I find this very frustrating. I lost my mother because of an issue like that, where essentially a primary cancer was missed by multiple radiologists and a surgeon, saw it randomly. And I know that this is something that I think everybody can relate to in one way or another in their personal life. And so I guess how did we end up in male fertility or infertility? I think there's three reasons, kind of. First, I think the first touch point I had when I was a medical student, we're doing fertility rounds. And they were showing us how semen analysis was being done, and you had a row of lab techs peering into a microscope and like tapping a hand on a counter, and I'm like, wait, this is how you assess sperm? Like, this looks extremely imprecise. Why isn't machine learning being used for this, right? And I think back then the technology was just not ready for it. It's actually a bit more difficult than I thought it was. And, second thing is from a public health perspective, which I am passionate about, is the neglect of male infertility. Women and men contribute roughly 50-50 to infertility issues, but in practice, infertility is treated as a woman's problem. Most women go through a lot of unnecessary examinations, invasive testing before anyone ever checks their partner. And it's just inefficient. It's unequitable. It's really unfair, right? And third, and that was what I was mentioning on a previous startup before, my co-founder Jayla brought a strong market perspective to this. We saw that this was an underserved and growing space. The need is high. The clinical practice is outdated. The existing tools are decades old. There's a massive variability. And I think it was clear to her that it was both medically and commercially a wide space where innovation could have a really big impact. And so for us, male fertility is a fascinating and high impact starting point, but it's not the end point. So what we're building is really a platform for analyzing other fluids as well.
That's awesome. And you touch on a lot of great points. For our listeners out there, when you do a semen analysis, you think that like, hey, it's going to go through this like cool technology. At its core, in a lot of places that may not have access to, what we'll talk about later, computer assisted semen analysis, you basically take a drop of the semen, you put it on a little microscope, you put a little actually diagram right on top of it. And there's someone that's sitting there hitting the little counter button, counting sperm in area, and then multiplying and then, abstracting the information. So it's actually like done by brute force, which is crazy to think about when you think about all the technology that we have at our hands. So, Michelle, exactly what you're talking about, the inefficiencies, how medicine needs to kind of really catch up. I think that's some of the cool stuff that you guys are doing. So why don't we talk about that?
Wait, quickly, I want to comment as well, because I agree. And I think that the goal here in general is to remove human error and subjectivity out of things and numbers and lab results that need objectivity, right? And one thing that, you hear all the time, Kevin and I see patients all the time for is like patients coming in with low morphology. And morphology in general is something that I don't care about unless there's very specific, very, very rare situations where morphology is important, 0%. But you're talking about globospermia, like, which is, I've never even honestly seen. But the point is that you have something like morphology, which is the shape of the sperm. So someone's looking under the microscope, they're going to, that tail looks a little weird. That head looks a little weird. That neck looks a little weird. That is a subjective measure, observation,
There is
kind
some
of a subjective.
criteria. There is
Right,
some
of
criteria,
course.
right?
But remember, they've done the study, right? This is
Yeah,
why
yeah,
morphology is not important. They get the same specimen to 8 of the best labs in
yeah,
the
yeah.
country,
Right,
and they
right.
said, is morphology 0% or not 0%? And none of the
Yeah,
labs
yeah,
could
yeah,
agree. So
yeah.
if you don't have a way to objectively diagnose or categorize something, the value of that, you know, field is 0. And so if you can somehow teach AI or machine learning to do these things and make it subjective, then there's value in it. But the way that it is now, in general, morphology has no value. So I think it's just to give an idea to our listeners why these kinds of things are actually
So I want to actually, you touch upon something very interesting, right? So I want to just set a premise for the listeners too. The gold standard today is manual analysis because it has the biggest statistical accuracy if done correctly with the sample prep and with the actual counting compared to any computerized systems out there. It's simply because those systems that you have other cells in semen samples too, and they misclassify, miscount, are not capable of doing this properly, right? So that's premise one. And then there's a very interesting study that was conducted around 10 years ago where they sent out a sample with a known concentration, which was, I think, 38, to 200 or so laboratories in the United States and told them, like, hey, do the semen analysis as you would do and tell us what you think the right number is. And like the numbers came back from 7 to 350. So you had 1,500% variability of results. Literally, a coin flip would have been more accurate than that. So semen analysis, even between labs, completely lacks standardization, which is why those results are so flimsy. So yeah, I agree with you, and I think
It's
that
concerning, right?
yeah,
That makes a difference between IUI, IVF, people trying for natural fertility. So, and that's one of the reasons why really we recommend you get, if you have a low
Two.
count, to get 2, because, we need more samples. We need more data. So sorry about that. So just so tell us about IllumiCell AI and what your technology does. I mean, it seems
sure.
like
I mean, it's really in the name, IllumiCell. We're illuminating cells. And like in one sentence, we do life cell phenomics at the point of care, is what we call it. So in plain English, we've built a portable small cell imaging device that can be deployed wherever the patient is, where it's a private clinic, hospital, or smaller practices, and does essentially a 3D visualization of the cell layers. And we layer AI on top of that to quantify the observations. For semen analysis, this means we can very accurately look at concentration. We can very accurately tell you more about the progressive motility and other values. We can look at morphology, agree with you that it's currently our lowest priority. But I think the even more interesting part is you have other stuff in semen, right? You have leukocytes, you have white cells. What is the significance of those cells? Nobody really knows, right? But if you were able to correlate it to metadata of patients, now that's where AI would be really interesting because potentially we could find some we could get more information out of this and potentially use this for prognostic or diagnostic reasons. But that's kind of next level what we plan on doing with this data.
So this is going to be a little bit of the nerd part of me kind of asking this question. So when I first did a review on it, one of the exciting things, exactly what you pointed out, the metadata that you could put on top of, like, let's say someone's, semen that they provide their semen analysis, adding all the metadata, adding their FSH, LH. How far away are we from that? Or is that totally possible with where we're at?
I think it's totally possible where we're at right now already. It's just a matter of getting access to the data, having high quality data to execute upon, and then validating it prospectively. We're working with a lot of hospitals and in the United States, but we've been recently to Hong Kong because we have investors there, and it's just next level what they're doing. The medical departments hired 48 machine learning engineers, 48 in one single
That's
department, and
crazy.
they went. They're essentially they have data coming in from over 50 hospitals, and they're just like building models, building. And like I remember we asked they showed us like this pathology modules that they built. We're like, oh damn, like it was like 50 million images or something. Like how many years did it take you to build this? They're like this. And we started 3 weeks ago. I'm like, wow. Meanwhile, Europe is discussing how to regulate AI. US is discussing how to monetize AI, and those guys are just doing it.
You got to
That's
do it.
so crazy. I mean, so but how far in the how far away you think in the US are we from doing this kind of stuff? And I mean, obviously your technology exists here already, but I'm saying from getting to that point, is there a certain number like that you need like that, I don't know how the metadata stuff works.
I'm not sure. I think the biggest issue as we see it is getting collaborations going. We are talking to multiple large hospital groups. It takes months to even get started
Of
and
course.
months for them to sign MTA and DTA and then months to sign and then suddenly a year passed and you're just getting started with what you're doing. And then you need to gather the data respectively, train it, and then validate it prospectively. So I think from a say we start today and we can immediately start collecting data and we have a metadata layer on top of that, we could probably have a first product or the first publication within a year, like most likely. But like you need strong collaborators who want to do this and are open to advancing it. And I think that's the biggest difficulty right now. There's a lot of red tape. There's a lot of administrative hurdles to even get there.
I mean, healthcare, United States, red tape, they all go all together, right? Those words
Welcome
all
to
just meld
America,
together.
Michelle. Welcome to America.
Well, let's go back to what you guys are building. What you guys have built. So you basically have this device that can detect or do semen analysis. So how can this be used as a tool for clinicians, patients, or both? Like what differentiates this?
I mean, I would hope that whatever clinicians use is ultimately helps the patients. Otherwise, it would be
Yeah.
more questionable. But if you ask who's paying for it, then we're selling to clinicians. The idea is that instead of you having to, and here that's another special point of sperm, right? You have a viability of a sperm sample of 60 minutes. Now, there are companies who claim like, oh, we have those transportation mediums and we can, like we can put it on there and it's stable for up to whatever amount of hours. But like from what I'm a bit skeptical because there's still quite a percentage of samples who then has a sudden drop off concentration after you remove it from the medium. So maybe while it's on there, it works, but ultimately, we try to decentralize the semen analysis efforts from specialized laboratories to clinics, to the physician who's actually talking to the patient, which is typically urologists or the gatekeepers of male fertility, which are usually OB-GYNs. I mean, no guy goes to their urologist and goes like, yo, I've been trying to impregnate women. It's not working, right? I mean, you Um, and so, yeah, ultimately, we're giving it to physicians to be able to have an immediate response and to make a clinical decision. But we also hope that this will benefit patients by reducing really the time and increasing accessibility to infertility assessment.
How long does it take for IllumiCell AI to, evaluate a sample?
Under five. Well, okay, it kind of depends on your internet connections. That is one that is
Oh,
one
so
that
you have to be online. So
yes.
it's not like a built-in device. You have to have internet.
Yes, and that has drawbacks, but it also has huge pluses. Essentially, with every single sample that we analyze, the algorithm gets smarter, right?
Right,
And
right.
so the cool thing is there is zero maintenance or calibration needed on the hardware. Everything is software based. So you have a very brief illumination of the sample wherever you are. It gets uploaded to the cloud, analyzed, and brought down. And that takes usually less than 5 minutes.
Wow. That's pretty awesome. That is really, really awesome. Very cool stuff, man. So, I mean, Obviously, this is a very impressive technology. We've alluded to how valuable this can be in the space, but really, what role do you see it playing in improving sperm or, sperm analysis or embryo evaluation in a tradition versus traditional lab methods really here? Like what's the overall benefit of this?
Yeah. So first, let me start off by saying I'm not an embryologist, so I don't pretend to be an expert in embryo development. But I think in general, well, it's multiple things. I think infertility is currently a very elitist sub industry of medicine that is accessible to certain socioeconomic groups because it's typically a cash pay business and most people can't afford it. So, what we can definitely do is bring down the costs by decentralizing, increasing accessibility, and by doing so, making the field more equitable. That's number one. I think that's where it's really useful. Number two is you get more information from the sample, right? So we can always go back to this, like, let's say we found some correlation between a higher lymphocyte concentration and maybe some cancer type. I don't know, like make stuff up now. We could theoretically go back and scan through every single sample we analyzed and see whether maybe some patients we saw before had that issue, right? So we could retrospectively look as the system gets smarter, get more information potentially from those patients about that. And you mentioned embryo development. I think that's already being done. You have those incubators. Uh, Actually, Dennis has one where you
Yeah, I
where you
saw Dennis has
you
one. Shout out to Dennis. Yeah.
go and like it does like automatic scoring and like parents can like I think
Come
do
look in, like they never remove it or something. Yeah, it's cool. So
um,
yeah, I mean, listen, it all makes sense, what's amazing about this technology is, like you said, its ability to learn and then retrospectively go back and take some data and really explore interesting things. Like the leukocytosis is always interesting. There's the always the argument as a white blood cells. Is it younger spermatids? These are things maybe AI can help us really understand better here for sure.
Well, I mean, I think what's really cool is that he's got this now huge data set that you can now like, before, when you're taking a look at the semen analysis, we were having like still images and all that stuff, maybe we would keep track of, but now you guys have this like huge data set that, some research out there again, collaborators that you work with, they can dig through and parse through that and try to link all these things together and try to identify some of the unknowns in, semen analysis or sperm, examinations that we don't currently know.
So and see, that's something I think is really cool, right? If you look at any other devices in this space, you have a cartridge, you put in semen, you put it in, and you analyze, and that's it. But like you can't really put other fluids in, right? So it's very specific to semen. The way we trained our stuff is, and because we've tried this out, and it was kind of exciting. Our engineers were like, "This is 90% chance this is not going to work," but essentially, if we label, say, leukocytes in our semen analysis. By the way, the labeling effort, that what makes the data really valuable, like kind of peer reviewed labeling to have very high quality identification of what we see. And then we put a slide with blood in it or urine. It recognizes the cell same type in other fluids as well. So it's transferred
That's
learning
cool.
across fluids. And
That's
that
cool.
really opens up a lot of things because I don't know, think of CSF and maybe potentially it saw some cancerous cells in our fluid. Like, oh, look, this is, I remember this from the other sample from patient X or whatever, right? So as we grow, we will see so many more correlations here.
Cool.
Amazing.
Um, so, you know, obviously we talked about ways that this is going to potentially change fertility in the space, but what about how this technology might change the way men think about their reproductive health earlier in their lives? Because obviously that's something that we've been thinking about, Kevin and I, is, access to information in our fertility and how, that is a window into our health can potentially, shift our future plans and shift how we live.
So that's something I think is actually really interesting. And I think the biggest shift will be around prevention, right? So we already accept that in women's health. Teenagers see a gynecologist, pap smears are routine, and there's like a clear preventative care pathway. Men don't. Like most men have never been to a urologist until they have prostate issues in their late 30s or early 40s, right? And in terms of fertility assessments only after their partner has been assessed. So, like, let's say we normalize having some sort of sperm test baseline at the age of 16 or 18, and we start repeating it every 5 years, a bit like a colonoscopy as a screening tool. I think the trend today is that paternal age goes up, and there is an oops moment these days where suddenly somebody goes like, oh shoot, like my sperm isn't viable, I can't get the woman pregnant. If we integrate this as kind of like a baseline, and somebody notices maybe in their mid 20s or 30s that there is a sudden drop, well, maybe then it's a good idea to look for reasons for that drop, or maybe it's a good idea to do a sperm freezing. And I think that, yeah, I think that's where this is going towards.
Kevin 100% agrees with you. I'll tell you that.
I'm a big believer in this. I mean, it's been published, right? Like most guys under the age of 40 haven't seen a doctor in for whatever, how many years that they, and you're absolutely correct. Females have this kind of pathway set where you go get your pap smear, when you're 16, 18, when you've hit like pubertal age, and that kind of sets that relationship up. Men don't have that. We also have a lot of evidence now showing that your reproductive health is a window into your overall health. So we have something so easy. And I know Justin loves to just say, like, hey, look, to do a semen analysis, you're really just very simply jerking off into a cup. That's it. It's something so easy that can be done. And
Easiest
you
to
can get
produce
Dude,
sample.
remember anyway 3 times a day. You might as well give us a sample of one of them.
Actually, Kevin, you touched upon something I'm really interested in as well. And like that goes also into Justin's earlier question. There have been multiple studies, especially out of Scandinavia, with over 50,000 people that kind of showed that sperm quality or concentration is an extremely strong predictor, independent of lifestyle factors, for mortality. And is debate about whether there is evolutionary biology reasons or potentially chronic diseases. The fact stands, if you are older and otherwise healthy and you have a bad sperm quality, you're likely gonna die earlier. So I do think that sperm assessments are a very interesting window for overall health in men. And I do think actually, if you look what's been happening over the last 10 years with all the fertility companies that have been coming out, like, Legacy, Mojo, all those guys, and the sperm racing earlier this year, which, I mean, they made it into a sport. I do
Yeah,
think we're on a cusp of male fertility getting more into the center of attention amongst the general public. And I do hope that it'll become less of a taboo subject than it is right now. Because, I mean, we pitch this to investors and they hear the word sperm and they start giggling. I mean, that's essentially what's happening.
for sure. I'm gonna turn it around now though. And obviously we've been talking about all the benefits, all the good things it can do. What is your biggest concern about AI in the health space? Because, when you read the stuff, things like data security, privacy comes up. What are your concerns of this technology?
Um, I talked earlier about under reliance on tools, but I think the problem is also over reliance on tools. These systems are probabilistic. What do I mean by that? I think a good example is if you ask ChatGPT or Gemini to give you information and quote it, and then it goes on PubMed, it'll typically give you information from a paper that has the highest amount of citations. This doesn't mean that that publication is right. Often it's a paper with way fewer citations that maybe overthrew what was known before. But now everybody who's going to look this up and like stop using their own brain will kind of go for oh wait, well, this is plausible, I'm going to take this information. And only true experts in the field will know, like, hey, no, this doesn't really make sense. And I think clinicians are very busy, so when they think if ChatGPT or Gemini gives them an answer that sounds authoritative but is wrong, they'll just find it plausible and go with it, and it's going to slip past our filters. And I think that's where harm will happen. You'll have an automation bias, you'll trust it too much, and I think there's going to be kind of an erosion of judgment. Everybody will kind of suddenly jump to the same conclusions. And a second thing is the data quality and representativeness. So essentially, it's garbage in, garbage out, as
yeah.
with anything.
Yeah,
If you don't have the tail data for any AI model, then you will only focus on a certain data set and make mistakes. And I think that is the biggest danger when it comes to AI in health.
Those are great points. I find, because I use ChatGPT, I know Justin does too. Like, we use like in so much of our lives, even something that's like, cooking. I'm like, oh, I got this stuff,
Yeah,
you
yeah,
know,
yeah, yeah.
put together a recipe. And what you start realizing, if you're not a specialist in the area, like, if I'm not a specialist in fertility and you type in a question, the way how it responds can get you to trust it so easily. And you start to, and, as I'm going through, I start going like, hey, I'm not giving even vet it, even though that's what you're supposed to do. You just kind of go like, oh, I'll take that as truth. And get that, the biases, the gray zone of whatever it's making a determination of providing that information, that is pretty scary to me to a certain extent. Even though it's great technology, the unknowns of it do scare me. I don't know, Justin, if you feel the
I
same.
think that, I think the problem is inherently when you hear a robot or something that you're told has this vast knowledge base, more than a human. Humans are, you're going to believe that, right? You want to believe that compared to the knowledge of another person. I can't tell you how many times, like on Instagram, I've commented on someone citing something, and then people replying with citations from like open evidence or chat gpt, and then I go through those papers, and exactly like you said, Michelle, a, they're not relative to the actual stuff. B, they're not real papers, they don't actually exist. But it comes to the point where you have to be like, having citations doesn't matter if you don't have the knowledge and understanding to actually go through that stuff, right? So just because a citation exists doesn't mean it's good, doesn't mean it's real, because as physicians, we all know, first off, any argument, I can find a paper to back me. The second thing is, you can't read a paper and understand if it's a good study or not. So like, we have this unfortunate thing. I was telling my friend today where everyone in the world we live in, and I don't blame politics, I believe it is just social media, YouTube. We are the YouTube generation where everyone has an opinion, and we feel that our opinions are important more so than others, even if they're more specialized. And when you have something like a computer that is going to validate your opinions, that's where you can get in trouble. So I do agree with you. I think that we have to, in a world of chat GPT, open evidence, we have to use those tools as a patient, as a person, you know, but we also have to understand its limits, and more importantly, understand our knowledge limits and use other people like specialists to get the information we need.
100% agree.
So, Michelle, I know you kind of touched on this earlier, but just about what you're doing with the Lumicell AI. But we've talked about how AI in male fertility and what it can be done for. But what do you see AI applications beyond fertility in men's health specifically, or other medical specialties?
I mean, here, honestly, let me ask you a question back. Name one specialty where AI won't be useful or effective, right? I mean, in surgery, it's guiding robots. In internal medicine, it's interpreting scans or labs. In oncology, is refining diagnostics. Even in EHR, reducing the administrative burden. I think as a physician, you spend, I think, 70% of your time just writing reports and looking through stuff.
Yeah.
Terrible.
Yeah.
It's
I can't
terrible.
imagine any specialty where you will not use AI to make your lives easier and more patient centric.
Well, I hope
Absolutely.
surgery waits till all the way till the end. As a surgeon, I
Yeah.
really hope that's the last point. Everything else, paperwork, please just do that all for me.
I agree with Kevin, but how about in the male reproductive space in the next 5 to 10 years? Where do you see AI taking us?
Yeah, I mean, that's a good question. I think I'm going to give a bit of a general answer. I think we're underestimating how fast things are advancing. If you look at, even the level of ChatGPT 2 years ago, it was maybe on a level of a grad student. Now, if you look at ChatGPT 5 Pro, it's already on the level of an assistant professor who has like 10 years of experience. Give it another 2 to 4 years. And I'm
God.
seriously worried about a lot of jobs out there. I do hope that what do we want in medicine? What is the problem in medicine? It's not affordable. It's often not accessible, and we're treating rather than preventing. And I do hope that we can address those three issues in terms of patient outcomes in general with the help of AI. And I know that's a very general answer, but I think that holds true for almost any aspect of medicine or also male health.
Yeah, I mean, I think the one thing that is going to be really valuable is machine learning. And I know that this is starting to be looked at. I've seen some publications or some presentations in not on a specific kind of semen analysis, one with no sperm, and assessing the quality of that sperm, assessing the ability for microteses, which is a surgery for people who have NOA, non-obstructive azoospermia, and then giving us better predictive tools on success rates for that surgery and finding sperm. And I think that that is where I think some of this kind of technology will be really valuable in the future, whether it's from the pH, other things that we can't notice maybe in the sperm that or semen that maybe AI can, and to give real numbers, because Kevin and I know pretty much anyone who comes in with that, we just give them 50% chance success rates. And obviously that can be frustrating, especially in a cash pay procedure. And if we can give more realistic expectations, I think that can really change some family planning decisions, potentially. So I think that that is somewhere where I see, in at least your space, significant value to what you're doing.
So I can actually give you a little taster of this and what you just mentioned in non-obstructive xerostomia and macroteses. This will be, and I'm not allowed to mention too much. I know this will be published over the next year or so, but that's exactly what has been worked on for the last 5 years
Yeah.
by a
Yeah.
group that I know. And essentially, they exclusively looked at negative samples, and in almost 100%, they were able to detect sperm and show exactly where it should be collected. And I think
Wow.
that that's going to be a game changer.
Wow.
Yeah.
That's big time. That's a true game changer in the space, because we have that technology, and that's something that's going to be really important. So that's very cool. I
They
think
won't
we
even
should.
need the surgeon anymore. They're going to be like, "Yo, you're going to go right there."
Well, just keep doing podcasts and talking about it. That's
There you
great
go.
too.
Yeah, good idea. All right. Well, this was a great episode, man. We'll wrap it up here. So, Michelle, tell our listeners where they can find you if they want to reach out, or about the company, or so they can learn more.
Sure. I mean, you can just go on IllumiCell.ai if you want to know more about us. Our team is in Boston, so if you want to drop by, have a coffee with us at the Harvard Political Life Lab, that's also a possibility. Or if you're in Europe, we also have an office in Zurich, so that's another option. And while you're there, you can go skiing, so that's always great.
All right. Thank you so much for coming on. This was really, really interesting, really fun conversation. For Kevin, guys, and Justin, thanks for listening. As always, download, subscribe, give us a review, 5 stars. Until next time, have a good one. Thanks.